Mastitis is a condition that causes the breast tissue of a woman to become abnormally swollen or inflamed. It is frequently caused by a breast duct infection. Breast pain, swelling, warmth, and redness are the result of inflammation. Fever and chills might accompany the inflammation. It can affect both breasts in rare situations. Mastitis most commonly affects women who are breastfeeding. It often happens while a woman is breastfeeding, especially during the first 6 to 12 weeks. However, mastitis can also affect men and women who aren't breastfeeding. If you have any of the following conditions, you are more likely to get mastitis. Sore or cracked nipples. A woman with previous history of mastitis while breastfeeding is likely to get mastitis. A woman with breast implants is at a higher risk of getting mastitis. Wearing a tight-fitting bra or applying pressure on your breast when wearing a seat belt or carrying a heavy bag, which may hinder milk flow. Smoking or nicotine addiction will predispose one to breast inflammation. Eczema or a skin disorder of a similar nature. Nipple piercing. And diabetes or other autoimmune disease that lowers the functioning of your immune system. 2 causes of mastitis are known. The first one is bacterial infection. The most common offending organism is Staphylococcus aureus from the infant's nose and throat. In cases there is a crack in the skin of the nipple, bacteria from the surface of your skin and your baby's mouth can enter the milk ducts through a fissure in the skin of your nipple, or a milk duct hole. This eventually causes mastitis. And the second cause of mastitis is obstructed, or blocked milk duct. Milk ducts are tubes that deliver milk from the breast glands to the nipple. When these ducts get obstructed, milk accumulates within the breast, causing discomfort and bacteria growth in the stagnant milk, leading to infection. The different types of mastitis include lactation mastitis. It is also known as puerperal mastitis. This is the most common type. It mostly affects breastfeeding women. And the second type is periductal mastitis. Periductal mastitis is more common in menopausal and postmenopausal women, as well as smokers. Signs and symptoms of mastitis can appear suddenly and mostly affects one breast alone. But in some rare cases, both breasts can be affected. The first symptom to appear is a swollen or enlarged breast that is characterized by redness that is wedge-shaped, swelling, tenderness, or a sensation of warmth on the breast. This is followed by flu-like symptoms like fever and chills. Generally feeling ill. Discharge from the nipple. Breast pain, also known as mastalgia, or a burning sensation that becomes worse while your baby nurses. And a breast lump, or thickening of breast tissue. Clinical diagnosis of mastitis can be made from the history of your symptoms and examination of the breast. Your doctor will check for swelling, tenderness, and a painful, wedge-shaped area on the breast that is a telltale sign of mastitis. Breast milk culture can also be done. Other tests that could be done include a breast ultrasound, MRI, mammogram, or biopsy. Several forms of treatment for mastitis are available. If the mastitis has advanced to suppuration, the abscess should be drained. Breastfeeding from the affected breast should continue to decrease engorgement. This will maintain your milk flow and keep your breast from becoming overly full with milk. Analgesic medications like ibuprofen can be given to control the pain. Anti-staphylococcal antibiotics like cefalexin, dicloxacillin, and clindamycin can be used to control infections. The following techniques will help you prevent mastitis. Avoid wearing nursing pads or tight-fitting bras that keep nipples moist. Allow your baby to nurse on one side for a few minutes before moving to the other breast. During feeding, make sure your baby latches on properly. If you need to stop a feeding, break the suction using your finger. Air your nipples out when possible. And finally, seek medical help if you have nipple pain during nursing. And that's all for this video. Thank you for watching. If this video has been helpful, please like it, share it, and subscribe to our channel. Until next time.